If you've ever stared at a diagram of the skull base, you know the feeling. It looks like a terrifying block of Swiss cheese. There are dozens of holes, dozens of nerves, and a seemingly endless list of vessels threading through them. Look at this 3D rendering of the middle cranial fossa. We're going to zero in on this specific opening highlighted right here, the foramen ovale. It is one of the highest yield pathways tested in medical exams. Here is exactly how they test it. 5 options. Which of these structures actually exit the cranium through the foramen ovale? You have the Greater Petrosal Nerve, the Mandibular Nerve, the Oculomotor Nerve, the Accessory meningeal artery, and sympathetic nerve fibers. To manage this list, we'll organize these structures into a specific 4-letter sequence, MALE. This 4-part framework provides a reliable way to map the middle cranial fossa and systematically eliminate the distractors we saw in that test question. Let's start with this 3D map of the middle cranial fossa. That large structure fading in is the trigeminal ganglion. The M in our acronym stands for the mandibular nerve, which is the 3rd branch of this ganglion, cranial nerve V3. Medical students use the mnemonic standing room only to track the 3 trigeminal branches. V1 goes through the superior orbital fissure, V2 goes through the foramen rotundum, and V3 routes straight through the foramen ovale. That makes option B, the mandibular nerve, a verified true answer. Now look at option C, the oculomotor nerve. Examiners put this here as a trap. The oculomotor nerve goes to the eye, so it bypasses the foramen ovale entirely and runs directly through the superior orbital fissure. Option C gets crossed off. Knowing the precise routing of the trigeminal splits keeps you safe from proximity traps that lump all cranial nerves together based on general location. Moving to the vascular structures, the A in our acronym stands for the accessory meningeal artery. This diagram shows a close-up of the foramen ovale, next to its tiny neighbor, the foramen spinosum. Examiners love testing this exact pairing because of how close they are. Watch the maxillary artery approach the area and divide into 2 distinct branches. The larger branch is the middle meningeal artery, which takes the foramen spinosum. The smaller branch is the accessory meningeal artery, and it dives right into the foramen ovale. Because the accessory branch specifically takes the ovale route, option D is a true statement. By placing the middle and accessory meningeal arteries side by side, examiners target your ability to distinguish between 2 adjacent foramina that sit only millimeters apart. Let's tackle the L in male, which brings us to the friction point of option A, the Greater Petrosal Nerve. Pause the video for a second. Think about what the L stands for and decide if option A fits the acronym. This split-screen diagram shows the exact wiring. On the left, we see that L stands for the lesser petrosal nerve. That routes straight to the foramen ovale. On the right side, watch the greater petrosal nerve. It travels a completely different path, heading to the foramen lacerum instead. Option A is a distractor. Finally, option E suggests sympathetic nerve fibers. Autonomic twigs hug blood vessels throughout the body, but aren't formally named contents of this specific foramen. So both option A and option E are marked false. Test writers construct these distractors using name similarities, like greater versus lesser, and ubiquitous structures to catch candidates guessing without a rigid mental framework. That leaves us with the final letter of our acronym. E stands for emissary vein. This cross-section shows exactly what that vein does. It acts as a vertical vascular bridge, connecting the cavernous sinus above to the pterygoid plexus down below. Here is a graphic card summarizing the entire mechanism. You have mandibular V3, accessory meningeal, lesser petrosal, and the emissary vein, along with the spinosum and lacerum traps we just dissected. Grab a screenshot of this checklist right now to lock it in for your exam prep. Navigating the 3D space of the skull base is difficult, but using the male framework cuts straight through the noise.